From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is John Small, and I'm so delighted that you are with us today. We have a fascinating guest. Dr. Ajit Dhillon joins me, and he is one of the pioneers of cannabis treatments with applications to cancer, to autoimmune disease, and to bipolar disorder. He is a trained critical care physician from California, and he is also the co-founder and CEO of the EuroMed Institute, and, which we are going to talk a lot about, he is the advisor for guided tripping. And they are an organization that helps people who are curious about using psychedelics for their own personal growth. So lots to talk about here today. Dr. Dhillon, welcome to the show.
Thank you. Happy to be here.
So before we get into what you're doing now, I'd love to hear some of your background because you have such an interesting story. You were a Marine, correct?
I was, yes. Let me try to give you I don't like using the word quick, but life is not quick, but sometimes the stories can get lengthy. I went to an all-boys military high school in Georgia. You can imagine what that might have done in an inspiring national service and things like that. So I thought to myself it'd be a good idea right out of high school to go join the Marine Corps. I'm a kid from the 70s, 80s, so movies like with Schwarzenegger and Stallone have affected me. So I opted for what I now call the Hollywood package, which was I joined the infantry. Mm-hmm. And, I went in, I served with the Marine Expeditionary Units. I really went around the world and back, but more so, I gained a lot of valuable experience and perspective on life, which eventually, as I was getting out of the Marine Corps, I kind of was playing with the idea of becoming a physician. So much so that one of my duty stations happened to be in Connecticut, helping and being a part of a reserve unit, which gave me the freedom to apply and get accepted to a program at Yale University, which was around essentially people who were interested in medicine, but did not necessarily have a background in it. So it was a program that really gave you an opportunity to do the basic sciences, like a pre-med. Mm-hmm. It inspired me enough that as I was completing my contract with the Marine Corps, I eventually made the decision to take that route. I was already a few years older. I didn't necessarily want to do an undergrad in the US, so I took the European route. The European route is kind of like an undergrad and medical school combined into one, and I found that attractive. So I went and did that, stayed in Europe, did my training in Europe, came back to the States, did my boards, and then eventually really started getting interested in cannabis therapy because I had no idea the applications, particularly, and we can talk deeper into that about cancer, autoimmune disease, bipolar disorder, and a slew of other things too that I've found great effectiveness. But then with one of the things I do with psychedelics is because of my experience in the Marine Corps and seeing so many of my friends personally coming home, not quite themselves, whether it be in their mind, physical injury, or God, there's even been a few cases where I wish I was there to help prevent suicide. I've been really taken by the effects of how psychedelics can help integratively with psychotherapy and just essentially therapy in general. So there's kind of like my background. There's that I've done.
We could do a whole book on that, just that alone. But why, you could have gone in so many different directions as a physician. What was it about? And I'm going to I guess I'm going to put cannabis into the psychedelics, right? Do you consider cannabis a psychedelic? Is that technically considered a psychedelic?
I can say it's a double-edged sword. I think yes and no, depending on how I use it, you know? Because when I say cannabis, I'm not just talking THC, I'm talking CBD as well, and all the different worlds, like CBA, all of it, which, I've been lucky enough to get formally educated on. And that's right. That's what, but we can call them in both categories.
Okay,
sure.
Get it. So why cannabis and psychedelics? What was it about, had you had experience with those before you began your service and then your education as a doctor? Or was it that you saw the effects it was having in your practice? Tell me a little bit about how that all came about.
I had no exposure at all whatsoever. This is something that they don't teach you.
They weren't doing psychedelics in your Georgia Military Academy? I can't believe it.
I'm sure they did. I'm sure, out in the middle of, cow pastures getting shrooms. Sure. Yeah. But no. Actually, there was no experience whatsoever. They don't teach you this in medical school at all. It really wasn't until when I moved. I lived in Europe for almost a decade. And I had moved back And coming to the Bay Area, this kind of, let's say, progressive thought on alternative therapies, integrative therapies, was something I got exposed to with a few practitioners that I just randomly came across. I expressed an interest in wanting to learn more. So via them, in fact, I still work with an amazing pioneer. Her name is Valerie Corral. She founded WHAM, the Women's Organization of Medical Marijuana, based out of Santa Cruz. I mean, she was one of the original people that started Prop 215, which was the thing of medical cannabis legalization in California. We now work together. We're like best friends. So I was really, really lucky to be a part of that and really understand her experience. But a lot of it was really going through her pharmacopoeia of therapies that she has been doing since the 80s. And I was kind of shocked at what results she was getting, not necessarily in psychedelics, but mainly in cannabis, predominantly for cancer treatment. And when she was expressing to me how there was resolution with certain types of cancers, much like anything in life, you're not going to get a guarantee, right? But this at least offers an option, compassionate option to someone where other therapies, whether it be surgery, chemo, or radio, may have failed. And I'm reading this stuff, I'm talking to her about it, and I still could not believe it until I finally started meeting my first cancer patients with her and seeing what high dose cannabis therapies can do. And it blew my mind. And much like, hey, you look at this background I have being in the Marine Corps, well, I wanted to be part of this elite organization. I wanted to be on the front lines of this. This is something that no one else was talking about. This is something no one else was believing. And when you come out of medical school and you're training, cannabis is basically just mentioned as, hey, if you've got a patient who's having difficulty eating, whether it be late stage HIV or cancer, or maybe offsetting a few symptoms or side effects of some therapies, that's where it is. I had no idea that it could actually be used in something other than palliative care. And so when I started getting my first patients on my own, where I was helping them resolve their cancers, I had to stick with it. And there was a time that I could have gotten into a lot of trouble because it wasn't recognized. It's not a gold standard therapy, and it wasn't even really legal, really, in many cases.
What was it that you were seeing? What were the results that you were seeing? Was it more relief from pain? Was it a cure for cancer? Like what
it was a cure. Right. So when I say palliative is a relief, right? Whether it be a relief from pain or a relief for being able to eat food. I'll give you an example. There's a type of cancer, very common in colon cancer, called adenocarcinoma. And I had a few patients that, and again, this is based on my exposure and education on this. I also had done it's not taken very seriously, but it's run by a physician in Oakland here called Oaksterdam University. And there's a specific round of courses and workshops I did with them that were geared towards physicians. So that was part of my learning process. But with adenocarcinoma, we saw patients who were early on and up where they weren't necessarily responding to conventional therapies. And the idea is, well, why don't you continue the conventional therapies like chemotherapy, but let's incorporate cannabis in a very high dose THC, high dose CBD. And in case your listeners don't know what the effect of that is, in extremely high dose THC oils and extremely high dose CBD oils, CBD prevents something called angiogenesis, which is essentially the formation and production of new cancer cells, particularly in certain types of cancer like adenocarcinoma. And in high dose THC, these same oils initiate something called apoptosis, which is programmed cell death. And if any one of your listeners wants to do further research on this, there was some great research done at Ohio State University where it's been documented. Of course, we still are in a world where big pharma has taken over and that can't be considered a gold standard, but at least it's an option. So in this case, with a few of my adenocarcinoma patients that either chose to integrate this high dose therapy or say, hey, I'm done with chemo, I want to just do this, I was seeing results, and results that could not even be disputed by their oncologists. Was it effective with every one of them? No. But it gave a better outlook and a better option, which actually did show results. And it doesn't just range to that. That's just one example I gave. I have 2 patients that are still alive doing this therapy who had lung cancer, which in a lot of cases can be considered a death sentence. There's a few therapies I've had absolutely no results or really positive results in, one of which is pancreatic cancer. And I have a couple patients currently that have some rare blood cancers, one of which is my mother.
I'm sorry.
And No, it's okay. It's okay. No, it's one of those things where she's under great treatment, and I'm wondering if this is helping. She's still working. She has a great quality of life. So this is the kind of stuff that's convinced me to continue to go. And now what I do is, I don't take them necessarily under my wing, but it's more of like, let me Sherpa you. You want some advice? Let's talk about it. Let me give you the tools of what you need. If there is somewhere in Nebraska, it's not like I can send them the stuff. And the stuff tends to be really expensive. It's not like going and buying an eighth of weed. High dose oils for a cancer protocol can be thousands upon thousands of dollars to get.
Oh, wow. How are they administered?
Orally. Orally.
And they're high dose, so that I would imagine high dose of THC can get you pretty high.
Oh, absolutely. So, when you go through this process, especially for someone who's never done cannabis, we start them off small, taking small doses at a time until you eventually acclimate. The cool thing is that once you actually get to that level, CBD can kind of cancel off the psychoactive effects of THC. So you can find a nice little healthy balance where you eventually acclimate and you can do it. And when we say high dose, we're talking, both CBD at a 1 gram concentration of oil and and THC at 1 gram, both saturating at about above 70%, whether it be CBD or THC. And that's quite a bit. So you definitely have to go through an acclimation period. And eventually, most people can tolerate it, accept it, and then they kind of accept it more when they start seeing results with their oncologist.
So I'm going to play devil's advocate here. What is the kind of pushback you get from traditional doctors, more mainstream doctors, about cancer therapy treatments?
The biggest pushback is that they, much like, and I can't fault them for this because this is just the way you're trained as a physician. You need evidence-based medicine. And when you say that, it's like, oh, I have the evidence. Evidence-based medicine isn't saying, hey, I got a few people here that suck down some weed oil. There's my evidence, right? You can even show data. Oh, well, in a lot of these cases, they were also doing chemotherapy and other things. The evidence that they are looking for are peer-reviewed standard drug trials, okay, that we're all used to when we see clinical research done by big pharma or NIH. And even NIH has put out quite a few remarkable documents, but they're also not gold standard. So there's a fear on that. It's like, okay, let's say I'm an oncologist and the gold standard is to provide X, Y, and Z chemotherapy, but yet I chose to do this. And let's say it doesn't go right. Well, then they run a risk of having a lawsuit. So then it becomes defensive medicine. I need to protect myself as a practitioner.
Yep.
So that's the biggest pushback. For me, I don't deal with any of that because what I do with patients is that they ask me questions. I said, look, you can either take this or leave it. I can tell you what some patients do, what other patients do. At the end of the day, it's your choice how you want to apply that. Okay, that's your decision. But I am not saying that this will or will not, but here's what some of my personal experience.
Right. And it isn't for everybody, and it isn't for every type of cancer. So it's
Correct.
An option.
That's right.
I mean, there isn't a cure-all, right? I mean, I wish there were. My father passed from cancer, and, we tried things. He did like cannabis as a relief from the pain, but...
Yeah, no, I'm sorry to hear that. What kind of cancer did he unfortunately have?
He had a kind of a prostate cancer that was a very rare kind of prostate cancer that then metastasized into his bone. So it was a very aggressive, unusual kind of cancer. I don't know exactly the name of it, but I want to talk to you. Okay, so cancer is an extreme use. And since most of our listeners, well, many of our listeners have at least know somebody that is suffering from cancer. But I want to talk also a little bit about sort of everyday use of cannabis. And I want to talk about guided tripping. What is that? It sounds really interesting.
Yeah, it's actually a really awesome. So I have a license to practice in the European Union. And so this is a group that's based out of Netherlands. And my name got circulated through and was mentioned with the founder of this organization. And the founder of this organization wanted to meet me while I was in Amsterdam. You mentioned one thing I do, which is EuroMed Institute. That requires me to travel to Europe. And so I met her in Amsterdam and we talked about what I do and she talked about what she did. And I found what she did to be absolutely remarkable, particularly in the world of PTSD. And I immediately, of course, thought of my friends who are veterans and the messes that they are in. So guided tripping, which is a term that's used in the psychedelic community, which also happens to be a really great coincidence that it's the name of our organization over there, utilizes psilocybin, MDMA, and ketamine, not all together, sometimes combinations, but mainly, it's an option depending on what we evaluate as being a concern. Sometimes we work with their therapists, seeing where they're at, but it's essentially using psychedelics as a way of whether it be treating PTSD, some type of traumatic incidences, or in a lot of cases, people just trying to find their better selves. Now, you've heard all of these substances and they're recreationally used all the time. But under a program, which your listeners can Google, called MAPS, there has been huge evidence, and obviously I've seen this evidence firsthand now, of how it can be applied in helping a person, whether it be a traumatic episode or maybe questioning something, but guided and sherped through the trip, the journey of what it is, the duration of being under that substance, to finding a better outcome, or at least taking a giant leap from wherever they're currently at. And then obviously, much like how my exposure was to cannabis treatment, when I saw this firsthand, I was blown away. And particularly when you get feedback, if they're under the care of someone else. One amazing comment I remember a couple of years back was, they said, Dr. Dhillon, I cannot believe the outcome that I'm experiencing right now. This journey that was done was a few months back, but where I'm at with my patient currently, I probably couldn't have seen, or I haven't been able to achieve in 7 years of therapy. And so that's kind of cool, because that helps the practitioner change their mind if they want to send someone or even learn how to do it themselves. But again, it's a very gray area. It's a fringe area of science, but it's slowly gaining acceptance.
Yeah. And these guided trips, how do you approach it? Are you there? Are you one of the guides?
I am one of the guides. So what I do is I have the tough job with the rest of the team to disqualify someone if I see anything that could be a potential risk to the client, the patient, or to the practitioner. So that's really what I do, is I disqualify situations. 9 times out of 10, most of the stuff is not going to do anything. But
what would be a disqualifier?
If I have an 85-year-old patient who's had multiple heart attacks,
yeah,
who is in generally bad health, and it's like, yeah, this may not be a good idea, because what if something happens during this time and it's not going to look good, not going to look good for the practitioner or the organization, but at the same time, you want to obviously, you have to take care of your client, you have to take care of your patient. You don't want anything to happen to them. And for many people, when you disqualify them, that's disheartening, but most of the time they understand.
Yeah,
and
I understand.
That's sad that we can't get them to where they want to be, because in this instance, it becomes, in many cases, about quality of life, not necessarily something that's life-threatening. They just want to be better with themselves.
Yeah.
Yeah, I always hate when I have to do that, but in fact, I just disqualified one the other day, and I'm just not going to take that chance.
Yeah, I understand. So do you ever take people through guided trips through cannabis?
So the answer is yes, but I haven't in quite some time. In some issues where there's somebody who has insomnia or a generalized anxiety disorder, sometimes I'll be there with them to kind of, especially if it's those people that have never really done cannabis that much or at all. So I'll kind of be there with them to Sherpa them through and give them comfort along the way. But
I love that you call it Sherpa them. I love the Sherpa.
Yeah.
That's a great term.
I love the term Sherpa to begin with.
Yeah, it's a great word.
One of the fantasies I have is that one day I want to climb Everest. But first, I've got to climb Mount Rainier. So,
right.
Yeah.
Start in your backyard. Anyway, so you Sherpa, you have Sherpa people. It's interesting you mentioned generalized anxiety disorder, because that's something that I actually struggle with. And I find sometimes when there's too much THC, and I can get a little scary actually. And it all is set and setting, and sometimes you kind of wish you had somebody with you to kind of say, okay, you're feeling this way, but this is normal, whatever it is that you say. I am curious, like, what kind of things do you say?
Yeah, so it's not just about giving the cannabis. With this, THC can certainly do that, but also what I've discovered being in the Bay is there's a million different types of strains that can elicit a different type of response. Not all CBDs, for example, are created equal. So for insomnia, particularly here in California, there's a very specific combination that I do for insomnia and generalized anxiety. Not identical, but it's a very similar protocol where I incorporate a certain type of CBD with a certain amount and type of THC. And I say this a lot. I say that it's called the practice of medicine and not the certainty of medicine. The practice of medicine is more applicable in this situation because every human being is different. I need to find your threshold. I can't just say, go take 2 Advil and your headache's gone. I need to find where you're at. This is a game of, should I give you more? Should I give you less? We also incorporate food, diet, exercise, supplements, music, time of day. All of these are essential, as I've discovered, specifically with me. I'm not saying for everyone else, but for me to get that desired response. Okay, it might take a few months, but then it'll be like, hey, Jonathan, how you feel? Well, it took a few months, but you know what? I'm feeling pretty calm and cool these days. Hey, I'm sleeping pretty good. I think I want to stick with this particular regime that we've done. Great. That's your custom tailored dose. Let's figure it out. Let's keep a conversation going. Why? You can develop a tolerance. Maybe you might need more later on. Maybe a light event may have happened. So we have to be cognizant of that. And that's the way you do this correctly, in my opinion. As much as I love going to a dispensary and love talking to bud tenders, they're not experts. They know what works for them. They have a general idea of what works, but there are people that actually focus on this. And these are the people, when people look for solutions to disorders, or at least care for their disorders. And I don't even like using the word disorder really, but they got something that's bugging them and they need some help. It's good to get someone that has some better experience on this. And then with that experience, then they can utilize their dispensary and bud tenders much more effectively.
Yeah. A lot of us don't even know where to start to find a guide or a medical doctor to help us to, you just kind of go in a little bit blindly. And like you said, bud tenders are not always, they're wonderful and they have a lot of knowledge, but they're not necessarily trained professionals like you are.
Right. Right. And it's no discredit to them. I mean, they're just trying to help, but I can't tell you how many times I've gone where I blindly will go into dispensaries just to kind of hear what they have to say,
Yeah. Yeah. Yeah.
I've got a few senior patients, in California that don't want to go to a dispensary. So I'll go over and I'll get their CBD for them and stuff. And I'm just curious to hear what they say. And, shockingly on the other side, I get some really knowledgeable people, which is awesome. It shows that the industry is taking a conscious effort. But then I'll just hear one guy saying, oh yeah, man, this will be, and I'm just like, when I hear that, I'm like, oh God, I would hate for someone who is truly seeking something and looking for solid advice and then basing what their decisions are solely based on this one person,
Right.
It's not necessarily, I know their heart's in the right place, but it's not the right advice.
Is there ever an instance where you think that edibles are the best form for somebody to consume cannabis? Like, is there a certain type of patient that responds best to edibles?
The immediate answer, Jonathan, is yes. I prefer edibles, but see, I also consider gel caps and dosed out regimes an edible, just something that's ingestible. I do, because I can play with that. I at least know what's going on. Okay. When I do things, tinctures can be relatively, at least right now, unpredictable with dosing. I love it. I have nothing else if you want to smoke or vaporize, use a volcano or a pen, but I've noticed that I can't get the consistency where I can play with dosing, and originally I do. I mean, there were plenty of people who I would put on a CBD and just say, hey, just take one hit off of this vape pen, for example, just to balance things out. And then a lot of times it will work, and I won't discourage that. But if I'm dealing with a generalized anxiety or, insomnia, I like to have something that I at least have some confidence in the dosing, so I can play with that and know what I'm dealing with.
Yeah, so you know exactly what you're getting with the edible.
Yeah.
The only, I guess the downside with edibles is that, and it's not necessarily a downside, but the challenge is not always knowing when it's going to kick in, right? Because as opposed to like smoking, taking a tincture, which sometimes has a sort of rapid onset, it can take a little longer with edibles. I mean, Wana has brands, and not to do a Wana plug here, but they do have fast acting things that go quicker than most, but still there's a waiting time. So do you sort of factor that in when you're prescribing that?
Absolutely. It's about how it's deployed, the time to full effect. And most of the time, if I'm not, let's say, chirping or being there with someone who maybe is a little concerned, I always encourage them to call me or get in touch with me. I can't tell you how many midnight calls I've received. Hey, I think I'm dying. Nope, you're not dying.
Yeah.
And
I wish I had you on my speed dial in certain instances. You'd be like, oh, here comes small again.
But it's good that I'm there for that, because even just that interaction over the phone gives relief, right? And then we can talk about it later, and then it prepares them later. But yeah, we have to take all of that into consideration. And even if something is, for example, is advertised as something slow acting or delayed release or timed release, it doesn't mean anything to me, because every human's metabolism and how they process it is going to be different.
Yeah.
So, that's something I always take into consideration.
Let's talk about your own cannabis use. So do you consume cannabis yourself?
I do. I do. Absolutely. I like edibles. It's funny. It's really what I need. Like, I don't do cannabis every day only because I never know what might be coming my way if I need to answer the phone or
Yeah.
something, and it might be something that's urgent. So that's where it gives me pause. But whether it be for, let's say, losing myself at the end of the day, I know I have no responsibility. I might, I've got a big volcano. You know,
Hmm.
I have nothing against smoking it, but I just want to reduce any kind of combustible carcinogen of any sort, So I like the idea of vaporizers, certain ones. I know that there are a lot of people in the industry that don't do it responsibly. So I pick and choose, let's say, straight cannabis oil to vaporize. I have nothing against flower, but I like putting it through a volcano. And then there are some edibles in the form of whether it be a gel cap, a gummy, a tincture, or even, lately these beverages, like a sparkling water that's
Yeah.
I like seeing what's out there for myself, but it gives me an opportunity to kind of explain if I'm giving another, a client or patient something and saying, hey, this is what it did for me,
Yeah.
and maybe it'll do this for you, or here are some things to look out for.
What do you think it is about you? You know, you kind of grew up in a very, I mean, when you think of a military background, you think of like, and this could be just a stereotype, but kind of conservative, like straight and narrow,
Hmm.
following the rules, right?
Yeah.
And yet your career really, you're fascinated with sort of what one might call the fringes of medicine, right? And I don't
Yeah.
mean that in a derogatory way, but maybe not the mainstream, not the straight and narrow. I'm curious what it
Sure.
is about you think that drew you to that form of medicine.
Yeah. Well, first of all, I never consider fringe something derogatory. In
Okay,
fact,
good.
I consider it a badge of honor, because most things, if anyone takes the time to look at the history of medicine and pharmaceuticals, everything at any point was considered fringe, experimental, and questionable. Look at recently the way the country is split on vaccine for COVID.
Mm,
Okay.
yep.
I take that as a badge of honor to be a part of something like that. Now, what made me go in there coming from, I mean, there are two things that are kind of going against me. Yeah, the military, straight and narrow, follow the rules, all that. But I also grew up in an Indian Asian household where, these things are frowned upon,
Mm-hmm.
culturally. And then you, of course, take a societal look as well. Our generation, Jonathan, I'm going to guess that you and I are probably around the same age. We grew up in a generation where you've got Nancy Reagan saying, say no to drugs, especially things like cannabis.
Yeah.
And then as an adult, you start wondering, like, wait a second, I remember some anti-drug commercials talking about physiological harms, but I don't remember anything about cannabis. In fact, anti-cannabis commercials just would say, hey, it's against the law. And
Right.
nothing else really. So I've always kind of questioned that, but it wasn't until really seeing the evidence that it gave me the confidence really
Yeah.
to want to pursue that. The first thing as a doctor is you take something called the Hippocratic Oath, and one of the first things you say is to do the patient no harm. And if you can't give a patient every option and opportunity, I believe you are giving them harm,
Mm.
because you're not letting them know what else could potentially be out. So that's my philosophical take, and why it was really easy not to do that. Plus, when you look at what I do in the world of psychedelics, yeah, military is straight and narrow, but I have enough friends that have come home over the past 20 years where I also don't see, and I love this country. Let me just quickly say that. Okay, we have an amazing thing. We got it better than a lot of people. Criticize it all you want. Good. Go to those countries where they don't have it like here, and then you'll come back and realize just how good we actually have it.
Mm.
But I don't see the kind of care that was coming to my friends, and in some cases they hurt themselves. So that made it really easy to want to take care of them in this way and go against, the conservative grain.
Right. Well, I'm glad you did, and I wish there were more doctors out there like you. If people want to find out more about you, maybe work with you, is that an option?
Well, of course. I mean, I will not deny anyone an opportunity to be helped. Of course.
Right. And so, how do they find you?
I think the only place I'm really kind of, let's say, advertised is guidedtripping.com.
Okay.
And I think that might be one of the better ways. Yeah.
Well, Dr. Dhillon, thank you so much for taking the time to talk to us today. It's just been really interesting.
Absolutely my pleasure, Jonathan.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to WANAbrands.com. That's WANA, W-A-N-A, brands.com.